All right. Well, what we'd like to talk to you about today is medical care at home, what you need to know. And I've tried very hard to put this all into some very simple basics and to help all of us understand exactly what it is we need to do, when we need to go to the doctor, when we need to take care of something at home, what resources are available to help us know what to do, et cetera, and so on. And in sharing this information with you, I want to apologize ahead of time for making myself look like a complete and total idiot because I am, after all, a husband. And so that comes with, well, if you're married and you're a female, you know that we're not very smart sometimes. So today we're going to just talk about three things. What is self-care? We're going to talk about when to use self-care versus medical care. And then I'm gonna share with you some of my favorite self-care tools, and we'll answer. I'll be happy to field questions at the very end. This whole presentation is only going to take about 25 minutes. We'll have ample time for questions at the very end. So if you could save those to the end, will be great. All right. I used to be a faculty member at Oklahoma State University, which it's in the middle of nowhere. If you take your right hand and you point a finger and stick your thumb up, you've got the basic shape of the state of Oklahoma. Put your finger right in the dead center of your palm. That's about where Stillwater was. Tulsa was up about 70 minutes away, and it was we had to travel on the weekends if we wanted to do anything fun. There wasn't much to do in Stillwater, and one of our favorite destinations when our kids were young was the Tulsa Zoo because it was small. They had all the right animals. The kids loved it, and we would go there. We always would have to ride the train. I have two children, and they're both grown now, but we would ride the train together. We'd have a great time, and then we usually stop and get something to eat afterwards. And this one time when my son was about 3 or 3.5, we went to Jason's Deli, one of our favorite places. I don't know if they have Jason's Deli near you, but it's like any other deli. They just have all kinds of probably way too much food that you don't need to eat, but it was really fun. One of my wife's favorite places. So we went to Jason's Deli, and of course we've been at the zoo. We've been outside petting things and touching things, and so the first order of business before we sat down and ate our food was to go wash our hands. So I took my son with me. He was 3.5 at the time, and he was following behind me, dragging his hand along the wall. I don't know why, but that's one of the things boys do. And I opened the door to the bathroom and realized really quickly that the door was closing a lot quicker than I thought it was, and it was very, very heavy. And he got his little finger, his finger got smashed on the hinge side of the door, not in the part of the door that is closes, but in the hinge side, which means there was even more leverage and even more pressure. And I realized instantly, even before he started screaming, what had happened. Kicked the door open, but he was in severe pain. And this poor little kid was 3.5 or so, and he was crying his head off. And so I did the smart thing that any dad would do. I picked him up, I held his finger. We went. I gave him to his mother, and I went and got some ice. We put some ice on it, and within about 5 minutes, he cried himself to sleep. So this is where he smashed his finger. This is on his finger where he smashed it, on the ring finger, just above that first knuckle. So this is 70 minutes away. So we jumped in the car and we're driving home. Now keep in mind, I've got a PhD. This is what I do for a living. I should be more smart about this kind of thing, but in this case, I wasn't. So as we drove into town, we had to drive right past the Stillwater Medical Center on our way to our house. And he fortunately was sleeping the entire way. And so I said to my wife, we're going to pass the Stillwater Medical Center. Should we go into ER? What should we do? And she looked at me like I was a complete and total idiot. And she said, didn't you just go to a conference and bring back a self-care book for kids? And I was like, oh yeah. Yeah, I remember that. That was a free gift at one of those booths. And I brought back this free book. And so she said, why don't we go home? And he seems to be okay right now. He was asleep. And we'll just look at the book and see what it says. And I said, okay. So we went home. We looked at the book, and of course, I wanted to know: should we go? Should we call an ambulance? Should we go to the ER? What exactly should we do? And in the town Stillwater, urgent care wasn't really a choice back then, but now it is. It's in bigger cities. It's very, very prevalent, and it's a great choice in many cases. But it turns out in this book there was an entire chapter on smashed fingers. Apparently, this is a fairly common occurrence. Smashed fingers. So um, the recommendation was they said, well, did it involve a knuckle? And no, it didn't. It was above the knuckle, and it was an algorithm. It was a decision tree, and they said if this, then that. I read through it really quickly, and it said, okay, apply a home remedy, ibuprofen for kids, and some ice, and the other things that you might expect. And then they said, tape it to another finger. And so that's what I did. I taped it to his other finger, and he was a little concerned by that, so I drew a smiley face on it like that, and I said, "This is your finger buddy." And he thought that was really cool, and he wanted another finger buddy so his other hand could talk to his finger buddy. So we put some tape on his other hand too, and he had too, and they were, before you know it, they were talking back and forth, and we knew he was okay. Now, what was the effect on me and my family? Well, I didn't make a needless trip to the emergency room, which comes with a lot of distress, and as you know, comes with a lot of money. This same kid, when he was probably 14 or 15, he went up to a camp at a university, and he didn't have enough water. He was dehydrated and a number of other things, and he went into the shower, raised his arms up in the air, and the combination of things was too much for him, and he passed out, fell on his face in the shower. And when they found him, he was laying there in a pool of his own blood, buck naked. So they sent him to the emergency room, and I could tell you that cost $5,000 because that's what it cost me, and I had to pay it. And so we were able to save that money, that distress, that time, all because we had this resource. We checked, and it told us just put tape on his finger, and the smiley face was my own creation. So my question to you is, what if this happened to you? It could be some healthcare situation that occurred to you or to someone you love, an adult. It could be with one of your children if you've got kids. It doesn't really matter. I can tell you what you would do. What most people would do is that they would go to Google right away. And I would say in most cases that Google is not going to lead you astray. In healthcare situations, however, we need to be smarter. We are all Googlers. We are a nation of Googlers. What we know is that I think it's over 85% now of all internet users have sought health information online. And probably what they're going to do is they're going to go right to Google. We know that more people seek health information every day than visit a healthcare practitioner. So we want to know kind of what's going on and what's happening with the health of people that we love. I'm going to give you a little bit of a warning, and this is about using a search engine to find health information. This comes from a research study that is it's very, very pertinent. This is back when ephedra, kava, and echinacea were very, very popular as nutritional supplements. So this is the goal of this study that I'm citing from. They sought to evaluate the accuracy of content on commercial websites, and you could add search engines. So what they did is they used all these search engines to find all this information. I'm summarizing for you. Here's what they found. They found that nearly 90% of the websites suggested using a supplement as a drug. This is what you get if you use a commercial website like Google. Okay, only 20% of the websites cited any evidence. 70% had unsupported claims, and 66% made downright they falsified information. They just lied. What? People are lying on the internet? Well, that never happens. Yes, it does. It happens all the time. And so here are some of the unsupported claims. I thought this was kind of interesting. They said, you'll be the envy of others at family gatherings for ephedra. Okay, well, that's unsupported. Kava. This is one from one website that said it has an antiseptic effect on the urine. Really? Okay. Well, did you know that urine is antiseptic anyway? Okay. So echinacea apparently fights off HIV. You can see how this would be dangerous. Worse, here are some of the false claims. I thought these were really funny. Ephedra will liposuck the fat right out of your body and help you overcome your genetic link to obesity. Kava is a natural alternative to Prozac, Valium, and Xanax. And echinacea, most of you don't know this, but it's comparable to penicillin. These are some of the false claims, and they're very dangerous, and unfortunately, people believe them. So what exactly should you do? If I'm telling you, you're going to have a healthcare situation if you haven't had one already. When you do, you're going to want information, and you're going to want it right now. The knee jerk is to Google. Exactly, but that is the worst thing that you can do. And I'll tell you exactly what you should do. Okay, when you need information, where should you look? I think for me, I have thought about this and researched this an awful lot. And I think the best go-to for anything is WebMD. There are a lot of other apps out there. I have experimented with a lot of them. Some of them I couldn't even get past the intake questionnaire. It just took me so long. By the time I finally finished the questionnaire, I was ready to just throw my phone in the ocean. It was frustrating. WebMD is relatively quick. Click there. It will take us to the website, WebMD. Right up here, there's a couple of things I can check. You can check your symptoms, or you can go to Health AZ. So this helps you find information about common conditions. And if you've got a symptom, you've got maybe a smashed finger or something like that, you can click on this, and it gives you it lets you tailor your gender and your age, and you can put in your zip code, your email. That's all optional. And bada boom, there's just a few questions, and you've got some information about your symptoms, so you know kind of what to do. What I wanted to show you though is I've clicked on check your symptoms. Down here at the bottom on every single page, every single WebMD page, you'll see this seal right here. That means it's got URAC accreditations. I don't even know what URAC stands for, but actually I've forgotten. It's utilization review, something. It is one of the most recognized symbols of accuracy. At WebMD, what they do is they have purchased their content, a lot of their content from a company that reviews everything that goes out anywhere every 2 years, and it's reviewed by 2 people. And the people who review it are they're accredited, they're educated, they have at least a master's degree or higher. So it gets routinely updated. You're not going to get any better health information anywhere than on WebMD. So I would go to WebMD. That's where I'd go if I were a web user. They also have an app. If you want to download the app, you can get, and there I show the URAC accreditation seal. You can download the WebMD app really easily. I've got that's probably the number right after Twitter, so I can find out about my favorite sports team. WebMD is at the top row. I use it fairly routinely. You can download that as well. If you're a book user and you want a good book, WebMD also makes a book, but we love this book. We use this book in one of our campaigns, Self-Care Essentials. You can get it from Wellness Councils of America. That's Wellness Councils of America, WellCoA, wellcoa.org, WELCOA.org. I think the book is about $10, and the price goes down if you buy multiple copies. Maybe you can get some there for your work site, but it's pretty thin. What they've done is they've picked out key conditions, situations that people experience a lot, and they've summarized it. They've taken out a lot of the public health speak. They've put it in real people language, and they've just done a great job summarizing some probably I can't even remember, but I think 20 or 30 different conditions that are all there in that simple book. So we've got a couple copies here in our house. I know we've looked at it multiple times. It's a great resource to have. The Wellness Councils of America sells that book. So with that, you're sitting here thinking, all right, well, I'm not really sure. I've had a health situation, or maybe you're having a difficult time thinking of one. I've asked Becca if she would think of a situation that she's experienced that she wouldn't mind sharing with you to tell about how she used self-care. So, Becca, you're on.
All right. So this happened a couple months ago. My husband was experiencing some pretty bad pain. It was kind of on his side and in his back, and it just started out as a sharp pain here and there, but as the day went on, it got worse and worse and more frequent. And so I'll admit my first reaction was to Google. And once I kind of found some of the possible conditions that he might have been experiencing, we did go to WebMD and type it in there to get some more reliable information and kind of investigate a little bit. And I'm a bit of a worrywart when it comes to health stuff. So I was trying to convince him to go into the doctor, and he didn't want to. He thought that he would feel better soon. So pretty soon it was early evening and the doctor's offices were closed and it was getting worse. And so I said, well, why don't we go to one of the after hours urgent care locations around us? And so we thought about it for a little bit, and he still thought he was going to feel better. So we didn't go in, and so around 11:30 that night, it got really bad, and we knew we needed to get some type of help for him. And so we ended up having to take him to the hospital. And there's a hospital right near our house that I wanted to take him to, but he was smart enough to make me drive farther away to a different hospital that was in our insurance network. So anyway, we got there and they checked him out and they told him that he had kidney stones, which wasn't entirely a surprise to us because we'd already kind of, that was one of the conditions that we found on WebMD. Um, and so anyway, things resolved themselves and he was better the next day. And so I was glad that we'd kind of taken a look online at WebMD so that we knew what some of the possible conditions were. But I also think we could have made some smarter decisions by going into the doctor sooner, and then we would have avoided paying thousands of dollars for the ER. And so that's kind of a hybrid situation that we had where we used self-care, but also ended up using some healthcare as well.
Yeah, sometimes you can't avoid using healthcare, and that's we have the best system in the world, and that's why it's there, is so that we can use it. But we often use it needlessly. Research studies show us that we go to the doctor when sometimes when we don't need to, and I don't really think the doctors really care about that. I think they'd rather be safe than sorry. But the fact of the matter is, it costs money. It all costs money, and it costs somebody money, and usually it winds up costing us money. So here's your challenge. Here's my invitation to you is for you to think of a recent healthcare situation. It can be with you, it can be with a member of your family, somebody that you care about, sometime hopefully in the last year. Hopefully everybody's got something in their head now. Think of a recent healthcare situation you have. And then here's your homework assignment. Use a self-care resource to explore this situation. So I suggested that you use WebMD. If you're a phone user, download the app WebMD and keep it on your phone. Use it. If you're a web user, get on WebMD and search. You're going to find good information on there. Use the symptom checker. So the link is all the way up at the top on the left. And then ask yourself, did you make the correct decision? You don't have to tell anybody. You don't have to admit we just wasted $2,000. You don't have to do that. Just practice by using a situation that you've actually experienced. I think you'll be surprised at how easy it is to find information. So the goal is to save yourself stress, time, and money by treating things at home that you can treat at home and going to the doctor only when you need to go to the doctor. So there you go. That represents everything that I wanted to share with you today. Wanted to tell you about what self-care was. It's using good tools to make decisions in the moment of choice. Wanted to give you some of my favorite resources for self-care. I think WebMD, because of its URAC accreditation and because I know it's peer reviewed every 2 years, is excellent, and it comes in any form that you can consume. And then to give you this invitation to search out something on your own. I think with that, we have time for a few questions.
So I've got a question for you real quick. How do you feel about the teledoc offerings that are popping up now?
Well, that's a great choice, and we talked about that a little earlier. And the basic bottom line is, when you use a teledoc option, the same possibility exists. You could use a teledoc needlessly, or you could even say a nurse's helpline. You put this in the same category. They're there. They're actually nurses helpline, and a lot of times they're free. And that's a great resource to use if you have the phone number. A teledoc still takes time. It still costs you money usually, and it still uses the medical system. Even before that would be self-care, making a determination about whether or not to call the teledoc, which is going to cost you money, might be a good practice to have. But it's good to know that they're there if you need them.
All right.
Are there any other questions that we can answer today?
I would just add that we encourage employees, especially with teledoc when you're out of state, because our benefits plan, our benefits plan doesn't cover out of state. So teledoc for us is $40. So I agree, if you've gone through WebMD and still have questions, $40 with teledoc is less expensive than an out-of-network hospital visit.
Oh yeah, it's urgent care, emergency room. It's like I said, $5,000. You walk through the doors of the ER, it's going to be $5,000. That's great. Thank you so much for that. I'm not seeing any other questions. I don't know that people can necessarily type in questions, but any other comments?
I think we're good here. Thank you so much.
Well, all right. Thank you so much for participating. On behalf of myself, WellSteps, and Becca, we want to thank you all for being on this webinar today, and we hope that it made a difference and that we'll all be wiser consumers about medical care. Take care, everyone.
Thank you.
Thank you.